Good evening, Dipak bhai.
Good evening, Geetendra sir. Kem cho? How are you? Fine?
Yes, I am fine. Nice to meet you on this web meeting. Otherwise,
Same here, sir.
other than lockdown, we used to meet in person.
Yeah, those were days.
Yes, yes. So, for the benefit of the viewers, I will introduce Dr. Dipak Limbachiya. Dr. Dipak Limbachiya is very good friend of mine, and you will be surprised to know that he has developed many techniques in operative laparoscopy. He has trained more than 1,000 students in laparoscopy all over India, and he has developed his own innovative technique for doing Vardine hysterectomy by laparoscopy. That is known as Limbachiya's technique. So I have seen you working from the very beginning, sir, and your graph has improved from where to where I cannot explain. And he is most eligible laparoscopic surgeon to do all difficult most surgeries. And Ahmedabad is proud to have you as a laparoscopic surgeon in Ahmedabad. So he is always doing difficult most surgeries like endometriosis. Then he has developed the first technique to dissect para-aortic lymph nodes by laparoscopy. So welcome, sir, and happy to meet you through this web meeting.
Thank you very much, Geetendra sir, for kind introduction. And there are few questions in my mind. See, I'm working here since 13 years, and I passed my post-graduation in 2000. So I'm working as a consultant gynecologist since 20 years. Here in Shaibag, we are meeting you since 13 years, and whenever I required any kind of the help, you always help me. And especially whenever about the patient consents and everything. So in this platform, I would like to ask 3-4 questions specifically. Nowadays, we are getting a certain cases of the very difficult cases of endometriosis. And you know, it's a very enigmatic disease. It's not possible. Every time you can see that patient is having a chocolate cyst. Right. And you are inserting a scope, and if you see that the rectum is densely plastered to the posterior wall of the uterus, and we have taken consent of patient consent about the hysterectomy, but we didn't have any consent of the ureterolysis or the rectum separation. Right. So in such a cases, when we are operating this kind of the patient, and when we are dealing with the very vital structure that is the rectum, you know the complication of it. If it is a ignored injury. Right. So what problem can happen if we don't inform the patient's relative, and patient is already under anesthesia? In such a situation, what kind of precaution and what kind of the legal paper should be signed by the patient relative, or we should avoid the surgery?
Right. So what I understand that after taking consent, you have started surgery, and something other than consent is found inside. So what to do, how to tackle that? So to understand, sir, this, first of all, that you should take always elaborative consent. So your consent should be elaborative. As you are doing the difficult most surgeries, so it is always advisable that you should take excessive consent, means elaborative consent. So you should explain in advance to the patient that we apprehend that if this will be found, we will do this. If this will be found, we will do this. So like that, you should explain in detail to the patient in advance and take consent as vast as possible. So your consent should be elaborative and should be containing every details of the procedure. You should explain that if bowel endometriosis is extended to bowel, then we may injure bowel and it may lead to colostomy. It may be required that you may undergo colostomy and prolonged stay in the hospital. So everything, whatever you apprehend, whatever complications you apprehend, during these difficult surgeries, you have to explain it in advance. So one thing is,
whenever we are consulting the patient at pre-operatively,
yes,
when we are taking a consent pre-operatively, at that time we need to inform that this is very rare situation. But if
yes,
there is this kind of a rare situation, we
yes,
need to take a certain steps, and
yes,
we can give a call to someone to help us, or the colostomy, or ureteric implant, anything
yes,
we
yes, yes, yes.
would be
So
required.
while taking consent, you have to explain everything, and
Okay.
your consent should contain everything in writing. So
Okay.
that exhaustive consent should be there. So first of all that. Now suppose even if you have taken exhaustive consent, but something happens inside. So at that time, we must know that if you do something to save the life of the patient, then no consent at all is required.
Okay.
So suppose during surgery, if you have injured bowel, so you have to suture it. You have to take care of that bowel. So in such condition, even without consent, you have to treat the patient. So consent is not required in such circumstances when something is done to save the life of the patient.
Save the life of the patient. Yeah.
Now, what is advisable? Suppose some relative is waiting outside the operation theater. So in such circumstances, it is an abundant caution, although it is not legally required, but for your caution, you can go outside, explain the situation to the relative waiting outside, and for your benefit or safety, you can take signature of them after explaining everything on paper, and you should proceed with the surgery. So there will be no further problem for you. So medico-legally, complication per se does not mean that you are negligent. Okay. Yeah. So complication is a part and parcel of surgery. But if it happens, you have to diagnose it at the earliest, and you have to treat at the earliest.
Thank you. Thank you so much, Geetendra sir. You are the very dynamic person, and as I know you, always helpful. You must remember that before 8 or 9 years back, I had a problem, and I called you around 1 a.m. in midnight, and you helped me. You pulled me through that problem.
It was my duty, and you are my friend. So
no. Yeah, I observed that you are so much helping, and in a society and everywhere, you are always there to help even junior, or not only seniors, but with the juniors, you are always there to help them. So I would say you should come forward in a social and this gynec society like a FOGSI, yes. IAG, AOGS. Like as you were a president of AOGS, and now I would recommend that you please go ahead, and we are with you, sir.
Sir, this is your humbleness. I have seen you, and you have reached the stage now where whatever you can ask, you can get. And you are a renowned laparoscopic surgeon, and
I'm always there, sir.
We take proud of it, sir.
Anytime.
We take proud of it. So, giving me respect, it is a humbleness on your part. Thank you. Thanks a lot.
Thank you. Thank you,
sir.